Let us know how a patient can be diagnosed as a brain tumor. He will undergo a thorough neurological checkup of the patient, and it will be followed by imaging. Imagings are usually in the form of CAT scan or an MRI scan, and in few instances a PET-CT whole body scan is usually done when the tumor is seen in another part of brain and getting spread it in the brain. And once the patient is diagnosed with brain tumor, then the treatment modality is in the form of medications in few instances, and most of the situations it will be in the form of surgery. Few of the brain tumors can be dealt with without surgery in the form of medications where the tumor just melts away. It would be in the form of a chemotherapy or in some instances through radiotherapy. And in few instances, a very short course of radiotherapy, what we call it as radiosurgery, stereotactic radiosurgery, can also be dealt in dealing the patients suffering from brain tumors. Now, surgery is the main indication when the person is revealed with brain tumors. Now, in this modern era, surgery is quite safe. In fact, it is very safe, wherein there are multiple gadgets which get involved during the surgery in the form of an high-end microscope, neuronavigation, which leads us to the exact position of the tumor, wherein we won't disturb the surrounding brain tissue. And also we have tumor fluorescence, wherein we inject dye which depicts the tumor as a whole thing, wherein that part of the brain which is more getting fluorescence with the dye is removed. And the latest addition into the gadget is the intraop MRI, wherein we have a real-time imaging that the entire part of the tumor is safely resected or some part is left behind, wherein the imaging is done within the operation theatre itself with the help of MR. And once we find that some part of the tumor is still left behind, then operation is again proceeded till that part of the brain tumor is removed. And once the tumor is safely resected, it is sent for biopsy, and it reveals what is the type of the tumor, and depending upon that type of the tumor, the further treatment is proceeded in the form of a chemotherapy or a radiotherapy. And if it is a benign tumor, then regular follow-up scans are done. Have a check whether the tumor is reoccurring or not. So another important aspect is if the lesion within the brain is small, it doesn't require surgery, and we can have a serial follow-ups with serial imaging. And if the patient throws in any symptom, that's wherein it shows that probably the tumor size is increasing and the role of surgery or medications can come into picture. So my point is to say that not every brain tumor requires surgery. If it is small, we can have a regular follow-up, and if the size increases, then probably surgery can come into picture, or it can be dealt through medications, through chemotherapy or with the help of radiation.